Hello, my name is Ann Scott Blouin. I'm the president of PSQ Advisory, which is a company that focuses on patient safety and quality for governing bodies and for senior leaders. I'm here at the Kansas Hospital Association today to talk a little bit about quality and safety and the board's role in ensuring that they have appropriate oversight for quality and safety in the organization. One of the topics that is interesting and I think, quite frankly, very challenging for board members is the concept of transparency. How transparent should you expect to be relative to quality data, also price data? As many of you may be aware, the federal government is pushing hard our critical access hospitals and our hospitals across the United States to totally disclose and be forthright about the pricing structure of our services in America's hospitals. That same quality, that same transparency applies to our quality data, and we'll talk a little bit more about that as the session goes on today. But one of the things that is so important to understand is that our consumers, our patients and communities that we serve really are looking for information about our hospital services. How well do we do? What is our complication rate? How do we perform in comparison to other hospitals? There are a whole variety of external agencies and groups such as CMS, the Centers for Medicare and Medicaid Services, that provide a website called Hospital Compare. And on that are data that are important to take a look at because it's what the payers also look at, whether it's the Blues or United Healthcare, whatever the Cigna, Aetna, whatever the payer is, they're looking actually at your hospital's data to see how well you perform relative to preventing infections, preventing rehospitalizations, preventing complications when you treat patients at your hospital. And each one of these external groups, whether it's CMS or US News and World Report or Health Grades or any of the other groups that grade your hospital, they basically provide you with a different set of data that frankly, from a board member perspective, can cause some confusion. So while data is helpful and people are pushing for more and more transparency for the consumer, for the patient and the family, at the same time, the board gets really a cacophony of different data sources coming to the board, and the importance of making sense of that data and understanding it is really key. One of the things that, as I've worked with hospitals and health systems across the United States, that I found helpful is the concept of a dashboard, a quality and safety dashboard. Yes, you have to look at the things that the federal government requires us to evaluate and measure, but there are also some key things that your critical access hospital or hospital might be working on, special to you, important to you as a rural or small hospital in the state of Kansas. I'd recommend that an open discussion at the board be conducted so that it is very, very easy for the CEO and the senior leaders to say, how are we doing on quality? Now, from the CEO's perspective, it can be embarrassing, to be honest. Some boards now invite patients or family members who have had both positive quality and safety experiences, as well as some that are not so positive, to join either their quality committee of the board, if you have one, or a full board meeting to tell their story. They don't necessarily sit in on the whole board meeting, but they do have the opportunity to express in their own words what your hospital's services meant to them in terms of quality and safety. A simple dashboard with color-coded green, red, yellow is one way for boards to be able to get a handle on what's going on inside the hospital and the related ambulatory services. The next big focus that's happening across the United States is indeed quality and safety in ambulatory care, since much of our services that used to be inpatient are now shifting to the ambulatory setting. Same thing applies to long-term care. I'm on the board of a long-term care company, and looking at quality and safety there is just as important as looking at it in a critical access hospital or another hospital setting throughout the United States. So In summary, watch for things that are happening across the United States and have an open discussion with your CEO about how your hospital or critical access hospital would like to handle transparency of quality and patient safety data, given all of the inputs that we get as board members. Thank you.